We will be there to support provinces. We'll be there to support businesses. We will be there to support Canadians through this difficult time.
It has now been 2 long months since the World Health Organization declared a global pandemic. And just think of how much has changed. Back then, maybe the biggest concern for some folks was their travel plans. On March 11th, Canada reported just 118 cases of COVID-19 and 1 death. Now, nearly 70,000 cases and more than 5,000 lives lost. 3 million jobs were wiped out by public health measures. Millions more people had their hours cut. In response, governments have unleashed billions in stimulus money, and the isolation of physical distancing has become the new normal. So at this 2-month mark, we want to take stock of what we've been through, what we've learned or have yet to, and what lies ahead. So let's bring in Dr. Isaac Bogosh, an infectious diseases specialist, and Dr. Samantha Nutt, a physician whose work has taken her to some of the most devastated regions of the world, also the founder and executive director of War Child Canada. Hello to the two of you. And, you know, Dr. Nutt, maybe I'll start with you, but I'll have you both answer this question. 2 months in, what have we accomplished?
Andrew, we accomplished what we set out to accomplish, which was really to flatten the curve, to not overwhelm our ICUs, to ensure that those who became sick with this virus were able to seek care. And so we did do that. We were trying to avoid what was happening in Italy. We successfully accomplished that. At the same time, this tragedy has taken a terrible toll on our long-term care facilities, and so there are ways where we really, unfortunately, despite what we have accomplished, also missed the mark.
Dr. Bogosh?
I completely agree. I mean, the whole purpose of a lot of this major lockdown that we're going through has really been to prevent the overwhelming of our healthcare system. And thankfully, we have done so. Of course, Dr. Nutt just points out a few areas that we need to improve on. But in general, we weathered the storm and have weathered the storm in pretty well so far. Obviously, we're not there yet, but we certainly haven't overwhelmed our healthcare system today.
Well, and you talk about, Dr. Bogosh, the fact that we're not there yet. There is a research component to all of this. In your mind, what are the big gaps in our knowledge today?
Yeah, there's some huge gaps. Certainly, immunity is one of them. So for people that have recovered from this infection, to what extent are they immune, and for how long does that immunity last? I think we need a much better understanding on what exactly is the role of truly asymptomatic people in transmitting this infection versus people with mild symptoms versus people that have what we call pre-symptomatic spread of this infection. And of course, the elephant in the room is, you know, what are the best treatments for this? How do we develop an effective and durable vaccine for this infection? So those are the key issues that I see.
Right. And Dr. Nutt, I'm seeing you nodding your head. I mean, from a medical perspective, what is the fastest way to get the answers to those questions? And I also wonder, what are the barriers, too?
Well, I think everything that Dr. Bogosh has just said is absolutely correct. We still don't even know in this country how many people, even roughly how many people were actually infected, have been infected with COVID-19, may still be infected with COVID-19 because of the limitations to our testing, especially early on. So knowing who is immune, what immunity means. So one of the ways that you get the answer to that question is to conduct serological testing, to do antibody testing, to understand how many people may have already been exposed and what that exposure means in terms of preventing the future transmission or those people not becoming sick if they're exposed again. We still don't know the answer to that. But there are some good examples from elsewhere in the world. For example, New York, their public health, they just did a serological analysis, a sample, and they found that about 20%, actually 21% of people in New York City had already had some degree of infection with COVID-19. What that means in terms of whether they can get reinfected is still an open question, but we need answers to that in Canada, and the only way to get some of those answers is to conduct those kinds of studies.
More testing, more testing, more testing. Dr. Bogosh, though, vaccine. I mean, that's the other word at the tip of everyone's tongues. Are we all still in agreement that that is kind of the ultimate end game here?
It really is. I mean, if we have an effective and durable vaccine, this is our way out of the mess that we're in right now. Of course, we know it takes time to develop, but there's some wonderful vaccines that are under development, and we're going to have some really good results available as early as June with some of the vaccines that are in a more advanced phase. What we don't know is how effective those vaccines will be, whether or not those vaccines, if they are effective, if we'll need to have multiple vaccinations over time, or if one vaccine will be sufficient and provide protection for a lasting period of time.
You know, it's interesting when I think about how transformative this pandemic has been. I mean, it's not, strictly speaking, all bad. I think of the advances in virtual medicine, the fact that so many folks can work from home and do it well. Dr. Nutt, when you think of the new normal, I mean, walk me through, in your mind, the good, the bad, the ugly.
On the good side, I think as a healthcare provider, we have learned to innovate. There were very few adopters of virtual medicine prior to COVID-19. Now more than 70% of physicians in Canada are using some form of virtual medicine, making themselves available to their patients in a longitudinal way, in a more sort of organic way, which I think is actually important. It helps keep people out of the emergency departments, has really helped to stop overloading our healthcare system. So I hope those kinds of work from home lessons, even for doctors, that those will continue to apply.
Dr. Bogosh, I'll give you the last word. Same question, your portrait of the new normal.
Certainly from the bad and the ugly side, one other thing to add is I'm really worried about mental health. And I think that this is going to be a driver of deaths of despair related to suicide from substance abuse and overdose and depression and anxiety that can result from this, especially not exacerbated by some of the economic woes that many people are feeling. So I'm really concerned about that aspect as well.
Doctors, that's all the time we have for this, but we will have many opportunities to take stock going forward. Dr. Nutt, Dr. Bogosh, thanks so much.
Thanks, Andrew.
Thank you.